The WHO projects non-communicable disease-related deaths to rise by 15% globally between 2010 and 2020. Among the NCDs is diabetes, which affects 382 million people worldwide, according to the International Diabetes Federation, or IDF. In 2013, global spend on diabetes and its complications reached $471 billion, with experts stating that the Middle East region has seen a significant rise in cases by 135%. With these alarming figures, Ajman-based Rashid Centre for Diabetes Research is among the entities addressing the problem from the level of primary healthcare. According to the IDF, diabetes is expected to see greatest increases in Africa, the Eastern Mediterranean and Southeast Asia by over 20%. To help address the challenge, Rashid Centre for Diabetes Research in Ajman continues to educate medical practitioners in the country through a variety of programs. The latest is a scientific symposium on diabetes nephrology, attracting experts from Sweden who focused on the kidneys as well as the complications, prevention and treatment management.
If you have a higher blood pressure or a high blood pressure, the progression to end-stage renal disease will be faster and you will lose renal function. Poor renal function, especially in case of diabetic nephropathy, is strongly associated to other diseases such as stroke, myocardial infarction, further progression of renal disease, peripheral vascular disease, and so on.
On the same day, 12 primary healthcare doctors from across the UAE were honored at a graduation ceremony. They comprised the first batch to undergo a grueling 9-month course and specialize in the management and treatment of diabetes.
We are living in Northern Emirates with some remote areas that is far away from any near hospitals. Because of that, this course is really important to empower these mini clinics to attract more patients and improve the care of diabetes patients.
The center, run by Swedish company Global Health Partners, says continuous education is a key in fighting diabetes and delivering optimal care. Consultant endocrinologist and medical director at RCDR, Dr. Salah Abusneina, says they trained 60 nurses and dietitians last year. With the addition of the physicians, the essential team to put up mini clinics for diabetes is now complete. But the work continues, particularly in research.
We have a very big study led by the University of Sharjah, Professor Nabil Sulaiman. It's the National Diabetes Study, and our center is the main place to conduct that study by doing all the blood tests in our center. And the aim of that study is to look at the accurate prevalence and incidence of diabetes in the whole 7 Emirates, okay? And the results will be announced at the end of 2015. The second study we are doing, is there any difference in the genetic predisposition to the diabetes in UAE compared with the rest of the world? And the study is finished and will be published soon, within the next 2 to 3 months.
RCDR CEO Bengt Turnstrom says they would like to see the pilot project continue. And in the presence of His Excellency Hamad Obeid Taryam Al-Shamsi, Director of Ajman Medical District and Director of Sheikh Khalifa bin Zayed Hospital, they inaugurated the latest addition to the multidisciplinary facility, a pump room for diabetic patients who have difficulty injecting insulin, and a dental clinic.
We integrate the dental treatment into our care plan, which means that every patient who comes to us will go through a dental examination as a part of the initial assessment. What we want to do is that those who have now graduated should be offered the option of going forward to become maybe a diabetologist. But for that we need to affiliate with some university organization, and we have already started that with our partners in the university hospitals in Sweden. The second answer to your question is, yes, we would like to continue. We need some funds for it, and we really hope that the government of this country will now realize the need of this and the importance of actually making it happen.
The successful pilot project of the RCDR is just the beginning, according to experts. Now the work continues with more trainings, education, and research in an effort to better understand the contributing factors and what else can be done to combat diabetes in the UAE. Khadija Sali, 7 National News.